Today we will talk about miscellaneous classification of bones. Here we will put all of the classes or categories of bones that don't fit elsewhere. We have sesamoid, supernumerary, accessory, pneumatic and heterotopic in this class, and a special class wormian bones, but that is only present in birds and is not so important. Let's start with the first one, which is a sesamoid bone. It is from the word Arabic word sesame seed. That these are small rounded bones, mostly that develop in tendons. So what do you need to remember about them? They're mostly rounded and they develop in tendons, especially where tendons are arching over a long bone at an articular site. So their function is primarily articular. By articular you mean that their function is to form a joint or to help a joint in movement by decreasing friction, modifying pressure, or by altering the line of pressure or movement at the joint. These things we will be able to discuss later, but by articular you mean relating to joint. So there are various types of sesamoid bones in the body. A very typical example is your kneecap, the bone in the kneecap which we call patella, which is the largest, by the way, sesamoid bone in the body. So that is kneecap patella. Then you have got various bones, for example pisiform bone, which is a carpal bone which forms in the tendon of flexor carpial naris. Then flexor carpial naris. Then you've got various unnamed sesamoid bones in various tendons, and some of the sesamoid bones might be present in some people and the others might not be. Then we will talk about supernumerary or extra bones. Now the supernumerary bones, as the name indicates, they are extra, that they are not normally present, okay, but supernumerary bones usually develop along appendicular skeleton, that means your appendages, upper and lower limb, due to traction or pressure. A typical example is when people have an extra thumb or an extra finger, which we call polydactyly, which is the sixth extra finger, or polymelia. Polymelia means you have an extra limb. For example, you have an extra upper limb. It also includes those bones that have unfused extra epiphysis. In some cases, an extra epiphysis is formed from an extra center of ossification, and that remains unfused with the rest of the long bone. That can also be called as a supernumerary bone. For example, this is a typical epiphysis, but an extra one forms here, unfused and remains here. That is a supernumerary bone. Third class is an accessory bone. You can also put the accessory and supernumerary together if an MCQ is very confusing, and it is going to be fine. They're usually grouped together. But the difference between accessory and supernumerary bone is that accessory bone usually develop in regards to axial skeleton. So for example, some people have an extra cervical rib, right? An extra rib above the first rib that usually compresses on certain nerves and vessels and causes signs and symptoms. Some people also have two frontal bones, which are the bones in your forehead, right? Some people have fifth lumbar vertebra. Some people have a fifth lumbar vertebra that occurs in two pieces. So these are all examples of accessory bones. So you have to remember accessory for axial. Otherwise, accessory and supernumerary can be grouped together also. Fourth category is pneumatic bones. Now, among all of this classification, you need to especially remember sesamoid and pneumatic. They are important. Now, what are pneumatic bones? So, pneumatic bones are basically flat bones. They are flat bones. But there are such flat bones where spongy bone is spaced out and filled with epithelial lined air space. We will study in our histology section what an epithelium is, but for now you need to remember that I told you that flat bone typically has a central spongy area and it is surrounded by a compact bone on either side and it looks like a sandwich, right? But pneumatic bones are those structuralized bones, flat bones, that have a central air space which is surrounded by spongy bone on either side, and obviously that is going to be surrounded by compact bone, right? This air space is going to be lined by an epithelial layer, right? This is the structure of a pneumatic bone. Typical example of pneumatic bones are what we call the paranasal air sinuses. Okay, which get blocked when you have a nasal congestion or something of that sort, a sore throat or a rhinitis, etc. So these paranasal air sinuses, they get blocked. Now what are the typical paranasal air sinuses? You have the maxillary, which is the largest, you have frontal, you have ethmoid, you have sphenoid, and they all communicate with the nasal cavity or your nose. So when your nose is blocked, these air sinuses, instead of filling up with air space, they get filled up with mucus and you get that nasal tinge in your voice, which tells us that these paranasal air sinuses are there to provide certain resonance to our sound, which becomes absent when we have nasal congestion. That's their clinical importance. So they're very important bones, and they also lighten the skull. Now second important air sinus is a mastoid air sinus, which is present behind your ear, and it communicates with the middle ear cavity. So whenever you have a sore throat, oftentimes your middle ear gets infected and your mastoid air sinus also gets infected. That's the significance of mastoid air sinus. Then you have got the next classification, which is Wormian bone. But before studying Wormian bone, we are going to study heterotopic bones. Heterotopic bones are those bones. You need to remember the word topic is for site in the body, right? And hetero is for different. So heterotopic bones are those bones that are present at a site in body where they are not usually present. So these bones are usually present after trauma or friction, repeated friction. Okay, for example, after trauma to a muscle in thigh, calcium deposition occurs and certain area within the muscle is going to become bone. It is going to be transformed into bone. So that is going to be a heterotopic bone. For example, this is your thigh and it has all these muscles going within it. But a trauma occurs and after healing, calcium deposition occurs here permanently. Now this is a heterotopic bone. And it occurs due to a mechanism which is called metaplasia. We are going to study about metaplasia when we study histology.